Hi everyone, here we are again with some Q&A with my lovely Barbara. I get a lot of questions from my website, so please keep them coming in. And to kick off, we'll start with question one.
All right, Dr. Sibthorpe. Stephanie says that she's been getting Botox for the last 4 years. She went to a new aesthetic injector and noticed he administered the Botox right above her eyebrows. Is it a common practice to inject close to the brows for frown lines? I researched Google and it said that you can get droopy brows when injecting too close to your brows. I know I have to wait 2 weeks for the full result, but I would really like to know what your opinion is on this.
So that is a good question actually, because when you're treating the forehead, you want to typically remain 2 centimeters above what they call the supraorbital rim, or this eyebrow. Having said that, and that depends on your injection technique, if you want to raise the eyebrow, then you can actually inject into the eyebrow, but you have to make sure that you are targeting what is known as the orbicularis oculi, a muscle underneath this frontalis muscle. So you have to be very accurate with your injection. If you don't, you get the droopy brow, the droopy eyelid as well, potentially. And typically that's something that can be corrected with other injections, but in some cases may not be easily corrected.
Oh, because it takes a long time for...
You'll have to then wait for it to wear off. But
I've had a friend who had that, where she got a droopy eyebrow. All right, now Julie wants to know, what could she do to treat her crooked smile? She's curious as to why she can activate the muscles above her lip on the left side, but not on the right side. When she smiles, her upper lip raises, but not her right. I have a friend who had the same problem.
Mm-hmm. So crooked smiles, they can be, you can be born with them, or you can have them as a result of some trauma, where the nerve is damaged or the muscle is damaged.
Oh, yeah.
So we can use a Botox injection to equalize this degree of asymmetry. So it is something you can treat quite easily with Botox. But again, you really need to understand perhaps a little bit more behind it, what the cause is, whether it's something, as I said, that's being caused by trauma or an injury, or whether it's something that's more just congenital, she was born with it.
So you don't have to suffer having a crooked smile. You
No.
just go to your aesthetic doctor.
I'm presuming, of course, that she hasn't had any treatment which would have caused the crooked smile. So I'm assuming that that's the case.
Well, I'm assuming that people don't know that they can treat this.
Yeah, well, you can. So it's an easy fix if you know what you're doing.
Okay, well, that's good advice. Linda is asking, I recently had fillers on my marionette lines. I see little difference, but still have a deep line on the corner of my mouth, leaving a shadow. I was wondering if this is the best it's going to get, or if I need to put more filler in.
So you do have to be very careful in this area, because the temptation would be to put more filler in here to disguise the shadow. But you have to understand what's caused this as well. And how old is she? Did
she give an age? Didn't give an age.
Typically in an older person, you're going to have changes in the mid-face that are really resulting with this jowl or these folds or lines here. So you need to attend to more indirectly with fillers up here to give some lift. If it's in a younger person, then you can be using some very fine fillers just in that area. But we use a combination technique anyway, so we'll be looking to reestablish lift in the mid-face and then use some filler around this area to create what we call a myomodulation effect, which is really to stop muscles pulling things down as well. At the same time, perhaps restoring some of the volume that it sounds as though she may have lost as well. But again, we're going to be very careful the type of filler that we use, because you don't want to create like a chipmunk appearance and put too much heaviness in there.
Oh, that's good advice. That's it.
That's
no more questions.
Thank you very much. So if you do have any more questions, please go to my website and submit your questions through the email. Thank you.